Question 1. Which of the following is the primary reason why sterile processing, SP, technicians should study and understand medical terminology? A. To increase the complexity of instrument processing procedures. B. To accurately identify and provide the correct items when a surgical request is made. C. To assist surgeons in diagnosing patient conditions during an operation. D. To replace the manufacturer's instructions for use with personal judgment. Correct answer, B. Knowledge point explanation. Effective communication. Understanding medical terminology is a critical professional skill in the sterile processing department. It enables technicians to understand what is asked when a request is made, ensuring that the correct surgical instruments and supplies are delivered to the operating room, or this proficiency reduces errors and enhances the overall productivity of the surgical team. Options A and D are incorrect because terminology is meant to simplify communication and support safety standards, not increase complexity or bypass instructions. Option C is incorrect because diagnosis is a clinical role outside the scope of an SP technician. Question 2. Most medical terms used in the sterile processing department are constructed from which three fundamental elements? A. Prefix, suffix, and symbol. B. Root, connective tissue, and suffix. C. Prefix, root, and suffix. D. A header, root, and footer. Correct answer, C. Knowledge point explanation. Word construction. Medical terminology functions like a building block system. Prefix, added to the beginning to modify the meaning. Root, the core meaning, usually a body part. Suffix, added to the end to describe a condition or action. Understanding this structure allows technicians to break down complex surgical names they've never seen before. Incorrect options use non-medical terms like symbol or footer to distract you. Question 3. Which suffix would be used to describe a surgical puncture to remove fluid from a body cavity? A. Otomy. B. Centesis. C. Ostomy. D. Ectomy. Correct answer, B. Knowledge point explanation. Surgical puncture. The suffix centesis refers to a surgical puncture to remove fluid. Distractors A, C, and D represent incision, creating an opening, and removal respectively, which are easily confused actions for SPD technicians. Question for the medical term for the surgical repair or restoration of a body part is A. Plasty. B. Pexy. C. Adhesives. D. Rapaphy. Correct answer, A. Knowledge point explanation. Surgical repair. The core meaning is the restoration of function or appearance. While distractors B, C, and D involve some form of fixation or joining, only plasty, such as arthroplasty, represents a complete repair or replacement. Question 5. If a surgical procedure involves the creation of a new, permanent opening into an organ, which suffix is used? A. Otomy. B. Scopy. C. Ostomy. D. Eclasis. Correct answer, C. Knowledge point explanation. Permanent opening. The focus is on creating a communication or opening. The strongest distractor is otomy, which is only a temporary incision. Question 6. Which word root refers to the liver? A. Gastro. B. Nephro. C. Hepato. D. Cysto. Correct answer, C. Knowledge point explanation. Organ root identification. The word root hepato is derived from the Greek word for liver. Understanding this root is essential for sterile processing technicians to correctly identify specialized instrument sets used in hepatobiliary surgery. Option A refers to the stomach, option B refers to the kidney, and option D refers to a bladder or sac. Question 7. The word root for the kidney is A. Rhino. B. Nephro. C. Oto. D. Encephalo. Correct answer, B. Knowledge point explanation. Renal terminology. Nephro is the primary route used to describe the kidney. If an SP technician sees a request for a nephrectomy set, they must know it involves the removal of a kidney to provide the appropriate vascular and tissue instrumentation. Options A, C, and D refer to the nose, ear, and brain respectively. Question 8. Which word root refers to the heart? A. Pneumo. B. Cardio. C. Amio. D. Angio. Correct answer, B. Knowledge point explanation. Cardiac root. Cardio is the root for the heart. It is frequently seen in combinations like cardiovascular or cardiopulmonary. Identifying this route helps technicians prioritize specialized cardiac trays that often contain delicate, high-precision instruments. Question 9. The word root used to describe the skin is A. Derm. B. Osteo. C. Inuro. D. Chole. Correct answer, A. Knowledge point explanation. Integumentary root, derm refers to the skin. Procedures involving the skin, such as dermatomes used for skin grafting, are common in plastic surgery. Options B, C, and D refer to bone, nerves, and bile respectively. Question 10. What does the word root osteo refer to? A. Muscle. B. Nerve. C. Bone. D. Joint. Correct answer, C. Knowledge point explanation. Skeletal root, osteo means bone. This root is foundational in orthopedic surgery terminology, such as osteotomy, cutting of bone. While option D, joint, is closely related, its specific root is arthro. Question 11. Which word root refers to the nose? A. Rhino. B. Oto. C. Ophthalmo. D. Stomato. Correct answer, A. Knowledge point explanation. Nose root. The word root rhino refers to the nose. A common surgical procedure is a rhinoplasty, which is the surgical repair or reshaping of the nose. Understanding this root is essential for sterile processing, SP, technicians to identify specialized nasal instruments, such as nasal speculums or rasps. Question 12. The word root oto refers to which sensory organ? A. Eye. B. Ear. C. A tongue. D. A nose. Correct answer, B. Knowledge point explanation. Ear root, oto refers to the ear. In the SPD, you will see oto on specialized ear instrument sets used for procedures like a myringotomy, incision into the eardrum. SP technicians must distinguish oto, ear, from ophthalmo, eye, to ensure the correct microsurgical trays are delivered to the operating room. Question 13. Which word root is used to describe the skin? A. Myo. B. Neuro. C. Derm. D. Angio. Correct answer, C. Knowledge point explanation. Skin root, derm refers to the skin. Dermatitis means inflammation of the skin, while a dermatome is a surgical instrument used to produce thin slices of skin from a donor area for grafting. SP technicians handle and process dermatomes, which require precise cleaning and inspection of the blades and motor components. Question 14. The word root angio refers to which of the following? A. Nerve. B. A vessel. C. A gland. D. A joint. Correct answer, B. Knowledge point explanation. Vessel root, angio refers to a vessel, usually a blood vessel. An angiogram is an X-ray or image of the blood vessels. SP technicians must recognize this root when preparing vascular trays, which contain delicate clamps and shunts designed specifically for blood vessel manipulation. Question 15. Which word root refers to the brain? A. Encephalo. B. Rhino. C. Thoraco. D. Abdomino. Correct answer, A. Knowledge point explanation. Brain root, encephalo refers to the brain. For example, encephalitis is inflammation of the brain. SP technicians will encounter this route when processing specialized neurosurgery sets, such as craniotomy trays, which contain high-speed drills and delicate brain retractors. Question 16. The word root hystero refers to which female reproductive organ? A. Ovary. B. Uterus. C. Vagina. D. Fallopian tube. Correct answer, B. Knowledge point explanation. Uterus root, hystero, refers to the uterus, womb. A common procedure you will encounter is a hysterectomy, which is the surgical removal of the uterus. SP technicians must prepare specialized gynecological, GYN, instrument sets for these cases. Question 17. Which word root refers to the small intestine? A. Colon. B. Entero. C. Gastro. D. Esophago. Correct answer, B. Knowledge point explanation. Small intestine root, entero, refers to the small intestine. For instance, gastroenteritis is inflammation of both the stomach and the small intestine. It is important to distinguish entero, small intestine, from colon, large intestine/colon, to ensure the appropriate intestinal clamps and staplers are provided for the specific section of the digestive tract. Question 18. The word root chole refers to which substance or organ system? A. Urine. B. Bile. C. Blood. D. Lymph. Correct answer, B. Knowledge point explanation. Bile root, chole, refers to bile, which is closely associated with the gallbladder. A common surgical procedure is a cholecystectomy, the removal of the gallbladder. SP technicians must be familiar with this route to prepare laparoscopic gallbladder sets, which often include specialized clip appliers and cholangiogram equipment. Question 19. Which word root refers to the nerves? A. Myo. B. Neuro. C. Osteo. D. Arth/O. Correct answer, B. Knowledge point explanation. Nerve root, neuro, refers to the nerves or the nervous system. Procedures involving this system, such as a neurectomy, removal of a nerve, require extremely delicate microsurgical instruments. SP technicians must handle these neurosets with care to avoid damaging the fine tips of the instruments. Question 20. The word root thoraco refers to which area of the body? A. Abdomen. B. Chest. C. Pelvis. D. Back. Correct answer, B. Knowledge point explanation. Chest root, thoraco, refers to the chest, thorax. A thoracotomy is a surgical incision into the chest wall, while a thoracoscopy is a visual examination of the chest cavity. SP technicians must recognize this route to provide the correct thoracic trays, which include rib spreaders and lung retractors.